I'm starting.
All right.
Okay, so this is turned on?
Yeah.
Okay.
All right.
Okay,
It'll
great.
record here too.
So welcome everybody. I'm Sue Clockey, here from the Prevention Research Center for Healthy Neighborhoods. I'd like to welcome you to our seminar series. Really excited about today's presentation because it's a project that's very near and dear to my heart. But I would like to welcome you. If you've not been here before, good to see you. I hope that you enjoyed today's presentation. And if you are new, we have a sign-in sheet. We encourage you to sign in. If you're a repeat visitor, welcome back. We love to have repeat visitors, but we also ask you to sign in. The sign-in sheet's really helpful for us to track who's coming and how many people are coming so we can plan forward for providing you a nice light lunch. I hope you enjoy that. But it also lets us track the number of people that we're drawing and where we're drawing from. And it allows us to get in contact with you to let you know about upcoming seminars and special events that we sometimes host. So please do sign in. The sheets are out there. We have live tweeting. For those of you who like to tweet, we encourage you to do that. So live tweeting from the seminar, please use hashtag PRCHN seminar so that we can communicate with our partners and others who have similar interests in prevention, health promotion kinds of topics. Today's presenter is Elizabeth Antognoli, and she is a research associate in the Department of Family Medicine and Community Health. Her background is in medical anthropology. She also has an MPH. So very nice intersection of training and experience to contribute to projects. She is the qualitative analyst on this project that she's going to tell you about, and will share some of those initial findings from the Little Cigars study. So we're really excited to share this. I don't want to give too much of it away, but this is a multi-phased project, and we're really delighted to have this opportunity to share the first phase of this with you all now, and you'll get a chance to hear more about it. But we hope that this will launch some good discussion and some good questions. And without further ado, I'll turn it over to Elizabeth.
Thank you. Well, thank you everyone for coming. I understand that many of you had to brave the geese out front, and that was probably fairly traumatic, so thank you for making it in here. I am really excited also to share the findings with you from our first year of the Little Cigar study. And I'd like to start with some background, just basically a rationale on why we're studying nicotine dependence among little cigar users. So as many of you probably know, tobacco is still the #1 preventable cause of preventable morbidity and mortality in the United States. And part of that is due to a growing trend of increased use of little cigars. Little cigars contain nicotine, just like cigarettes. But while researchers have been studying nicotine dependence among cigarette users for decades, we really know very little about nicotine dependence among little cigar users. So how do you measure nicotine dependence? It pretty much relies on self-report of dependence symptoms, which is grounded in the experience of the smokers. We know that little cigar users have really pretty different smoking patterns and beliefs and practices than cigarette users. And so understanding these beliefs and practices is really critical for understanding nicotine dependence. What I'd like to do today is start out by giving you just a general overview of the Little Cigar study as a whole. It's a 4-year project, and we just finished our first year. Then I'm going to kind of dive into phase 1 of the project, which consists of interviews that we did with young people, adolescents and young adults who smoke little cigars. And then finished up by talking about what we're moving on to next, and really hoping to engage everyone in some good conversation about the topic, so I'll leave plenty of room for that at the end. So I'd like to start by introducing our wonderful team. We have really a great team of people, very multidisciplinary. Our fearless leader, Sue Flocky, she's been doing work on health behavior change, tobacco control and measurement for years. Erica Trappel, that I'm sure many of you also know, also working in tobacco control and specifically with little cigars, and also has expertise in health behavior measurement and surveillance. Mary Stepp brings her expertise in health communication and cancer prevention. David Cavallo also works in health behavior change and is our social media guru. Steve Zizanski brings his expertise in behavioral measurement and biostatistics. We have someone from psychiatry, Maria Pagano, who specializes in adolescents and in addiction psychology. And that's me. Medical anthropology is my background and experience, and as Sue said, I'm working primarily in the qualitative methods on this project. We have Rose Perez, who is our wonderful project manager, who does everything on the project from recruiting. She's been really instrumental in recruiting adolescents, doing interviews with adolescents. She wrangles the entire team together on a weekly basis, and has also been helping a lot with the analysis. Sarah Koopman Gonzalez also has some background in addiction and in little cigar users, and she's been helping with the qualitative analysis. Rashawn Braxton joined us in the fall and has gone right out there with Rose and trying to recruit people for the study, and she's done some interviews and analysis. And last but certainly not least, Hyun-Young Park, who has a newly minted PhD, has been doing all the quantitative analysis for the study. We also have quite a few medical students who've worked with us, and I think will continue to work with us during their research blocks. So that's been great. And then we also have a really good advisory group of 5 or 6 individuals who have actually participated in the study. So we've done interviews with them, and then they've expressed interest in further contributing. So they've been really helpful. They've given us feedback on everything from the study logo to how to more effectively reach little cigar users, things like that.
So before you move on, Elizabeth, I also want to introduce Brittany Labenti.
Yes.
Put her on the spot, but she's also joined the team, and she hasn't actually started officially, but has given us a little bit of her time early. So welcome.
Yes, welcome to Brittany. So wanted to introduce these folks and also thank them because they've all contributed in one way or another to this presentation, and they're a great bunch of people to work with. So the overall purpose of the Little Cigar Study is to develop a measure of nicotine dependence that's relevant for little cigar users. Our starting point is something called the PROMIS Measure, and essentially what that is a list of questions designed to measure nicotine dependence, but it's for cigarette users. So I'm going to show you, these are just some example questions from the PROMIS Measure. As you can see, some of them don't mention cigarettes, but quite a few of them do. So I drop everything to go out and buy cigarettes. So what we did was we took all of these questions and we made them product neutral. So for example, item number 7, we would say something like, when I run out of tobacco product, I find it almost unbearable. So that was sort of our first step, was to take this measure that was specifically designed for cigarette users and make it product neutral. So in phase 1 of the study, which is what we've been doing for the last year, and we're just about at the end of it, we have been doing interviews with little cigar users about their smoking practices and beliefs, their habits, and so on. And we're going to use this data to develop additional questions or items to add to the measure specifically for little cigar users. What we're going to do next is administer this revised measure via a web-based survey. And we're then going to validate the measure using biological markers of nicotine. And then finally, we're going to implement the measure into the Youth Risk Behavior Survey, which is administered here in Cleveland through the middle schools and the high schools. So that's just sort of the overview of all 4 phases of the study. So phase 1, so what we've been doing is collecting 2 samples of 30 each, 30 young adults between the ages of 18 and 28, and 30 adolescents between the ages of 14 and 17. So far, we've completed our young adult sample, and we have 21 out of 30 of the adolescents interviews completed. We actually started the young adults a couple summers ago, which was really before the official start of the project, because we had a medical student who was really interested in working with us. So he spent the summer kind of getting that going. And then last summer, we started with a couple other medical students and completed our young adult sample in January of this year, which is the same time we started the adolescent recruitment. And so it's really only been a few months. So it's great that we've got 21 of those already. How have we been finding little cigar smokers? So we created flyers and little study cards, and we've been posting them. So our first thought with the young adults was, where do people hang out? So we posted them on campuses, bus stops. And as we started doing this, we started getting feedback from individuals about where else would be a good place, and people are like, we see people smoking little cigars all the time in front of Tower City. And so in that way, we kind of expanded where we were trying to reach these people. And it really worked out pretty well. So here's just a graphic of our flyer and our study cards. You can see it's just a brief description of the study that we'll be asking them about their smoking habits, that the phone interviews last about 30 to 45 minutes. It's all confidential, and they will receive a gift card for $25 at the end. So that strategy worked pretty well for finding young adults who smoke little cigars. It became a little more difficult with adolescents, not so much finding adolescents who smoke, but getting them to pick up their phone and call us and talk to complete strangers about their smoking habits. We did have several reach out this way, but Rose, our project manager, has been really great about finding community programs, so mostly school-based programs that work with kids in this age group, 14 to 17, and then through them kind of reaching out to the people that they work with. So she's done quite a few interviews through these programs. Most of them have been in person, and those really seem to be very rich, the in-person interviews. I think people, our teenagers especially, are more comfortable talking that way. So the only requirement as far as eligibility was that they smoke at least one little cigar in the past week, and then they fit the age requirements for the 2 different age groups. Interviews were conducted mostly by phone, but again, some in person. All of them were audio recorded. The interviews covered, obviously, demographic characteristics. We talked to them about what products they smoke, so in addition to little cigars, if they smoke anything else, where they smoke, when they smoke, why they smoke, who they smoke with, their understanding and experience of cravings and of addiction. So we like I said, the interviews are a half hour, 45 minutes, and they really go in depth on these topics. After the in-depth interviews, we went ahead and did the PROMIS survey with them with the product neutral wording. And then at the end, they had a choice of an Amazon or a Target gift card. So all of the interviews were transcribed or in the process of being transcribed verbatim. So we have a huge quantity of basically narrative data that we then imported into InVivo, which is a qualitative software program. And the first thing I did with the preliminary coding was I created codes based on the general topics in the interview. So for example, addiction or a particular smoking product. And anytime that was mentioned or talked about, I applied that label to it. And so at the end of that, I was able to, if I wanted to learn about addiction, I could pull that up and everything that anyone said about addiction would be there. So that was sort of the first phase of coding. After that, I went through each of those topics and did a lot of rereading to try and figure out what are some of the similarities, what are the themes that are developing, what's different, what's the same between cases, are there any patterns. And At the same time, all of this was sort of brought back to the project team. We've had lots of discussions. So it's been a real cyclical kind of iterative process of discussion, reading, rereading. And the quantitative data was summarized using descriptive statistics. So before I get into presenting the actual findings, I wanted to say a word about types and terminologies, because there's several different products and subtypes of products, and as you can see, there's lots of different terms that people use for these things. So this is actually a graphic from a publication where people did focus groups with little cigar users and asked them to identify these products and talk about all the things that they would call them. So the main purpose of showing this is just that terminology is an issue. It's a challenge in terms of making sure that what you're asking them about, that we understand what they're talking about when they're talking about what they smoke. In our particular sample, there are two main, whoops, there we go. I have to hold it down. Two main products that people are smoking. This, which you could call the tipped cigarillo, although people don't generally use the term cigarillo. What people in our sample are calling this is just by its brand name, which is Black and Mild or Mild. And this is the other product people use, which is an untipped cigarillo. And again, the brands people usually refer to as Swisher Sweet or White Owls. These are the two products people are using. The Black and Milds, I think without exception, that's what people are smoking with the tobacco in it. The Swisher Sweets, some people smoke them as is with the tobacco, but the majority of people actually loosen the tobacco that's inside, take it out, and then refill it with marijuana. And that product is referred to as a blunt or a marijuana blunt. So you'll hear me using those terms at the talk. That's what I'm talking about, the Black and Milds and the marijuana blunts. So this is what Black and Milds look like. They have plastic tips, some have wood tips. They come in a wide variety of flavors, from wine and apple to jazz and casino, which people have tried to describe the flavors. I'm not sure I really get it. They're sold individually or in packs of 5. And then these are the Swisher Sweets. They come in even more flavors. Most of them are sort of fruit flavored. And again, you can buy them in a 2-pack or a full pack. With the young adults, we've got a pretty good representation of males and females. With adolescents, we have mostly males, so we're really hoping to fill in with some more females as we move forward. The mean age for young adults is 23 and 17 for adolescents. We're finding it challenging also to get the younger age range with the adolescents. Mostly African American. The young adults, about half of them are working full-time, another quarter are also in school and working, and another quarter are just in school. With the adolescents, obviously most of them are in school, and a few of them also work. So here's some of the smoking characteristics that we quantified. The age at first little cigar is similar in the two, 16 for adults, 14 for adolescents, so right in that sort of middle adolescence range. Now the numbers of little cigars smoked per week is kind of interesting. So the total median is 17. For adults, it's a little higher, 19 and a half versus 14. And most of that is actually accounted for by, so they smoke about the same amount during the week. Young adults are smoking almost twice as much on the weekends. And you'll also notice that there's a huge range here. So we have people who only smoke 2.5 a week, and we have this outlier here who smokes 140 a week, and I'll show that graphically in just a minute. So this is really interesting too. So we're talking about we're asking them about multiple products, and they're telling us about all the things that they smoke, and I thought this was really interesting. With the young adults, about 70% are also smoking cigarettes, and only 30% are only smoking little cigars. Whereas with the adolescents, you have hardly any cigarette smokers, and you have a lot who are just smoking the little cigars. And just sort of anecdotally from talking to the young adults, most of them say that they started smoking little cigars, not cigarettes. Now, looking at marijuana blunt use, half of our sample use marijuana blunts. Pretty good amount in both groups, 43% for young adults and 57% for the adolescents. So this just graphically displays these crazy outliers here. The means, again, are similar, a little higher in adults, but we've got a few people who are just way out of the ballpark. And we even, I think, questioned her, like, are you sure you smoke? I think it was 140 per week, and yes, she does. So who are these folks, and what is their experience like with smoking little cigars? So most people say that the first thing that they've tried smoking was little cigar. With the adolescents especially, that really seems to go hand in hand with marijuana blunts. It might be a little earlier on one or the other, but they really seem to kind of go hand in hand. First exposure seems to be most often, I'd say, in a group of peers. So as I'll talk about in a minute, people tend to share little cigars. They pass them around. So if you're in a group with your friends, the opportunity is going to present itself. And that seems to be how most people first start. A lot of people also had family members who smoked. They're also very easily accessible. So even people who are technically underage to be smoking, nobody reported any difficulty in going into a store and buying these. A lot of them had certain stores that they would frequent that they knew they wouldn't be ID'd. So what do people enjoy about little cigars? So everybody mentions the smell and the taste. Even with the unflavored ones, you know, they really enjoy the smell. It smells like marshmallows or coffee. They like the fact that they're inexpensive. If you have $1, you can go in and buy yourself a Black and Mild. People also talk about they enjoy the sort of buzz they get, sort of a lightheadedness from smoking them. And then once you've been smoking them for a while, people really talk about how they smoke to relax. That, you know, if they've had a particularly stressful day, they'll smoke a Black and Mild, and it's very relaxing to them. So how are they smoked? This isn't as straightforward as you might think. 80% of young adults, we don't really have the data in for the adolescents, but it seems to be less, do what's called freaking their milds, which is worth kind of explaining to you what that means because it is so common, and it's not a simple or easy thing. So they start to buy every single picture so everybody's going to use plastic wrappers, snip off the tip of it, and then you can wrap between your hands to the tobacco, and actually pull the shell out of the tobacco in the wrapper. So you're taking all the tobacco out of the shell until you remove it completely. Then, with the shell, there's actually a liner in there, and that liner is universally referred to as the cancer stick. That's taken out. It doesn't, apparently it makes it harder to smoke, and it also has an unpleasant flavor. And people might even think that it adds to the danger of getting cancer by leaving it in. So they take that out, and then they refill the cigar with the looser tobacco. And as you can see, they then enjoy it, as this young man is doing. So why do people freak Black and Milds? The word that's used often is that it makes it smoother and less harsh to smoke. It also makes the little cigar burn slower. And again, removing the cancer stick makes it taste better. So this is something that does take time and practice. It's a skill. And what's interesting is that it does seem like quite a few, some of the adolescents know how to do it, some are just learning, it takes them a while. Then among the young adults, as I said, 80% of them do it. And then again, just sort of anecdotally, it seems like with people who've been smoking for a while or maybe smoking more of these, they are less likely, they sort of stop freaking the cigars. It takes too much time, it's too much trouble. In fact, smoking a little cigar without freaking it is called grown manning it. So it's almost like there's a trajectory of this habit. So cigars sort of have the reputation of something that you puff rather than inhale. That doesn't seem to be true. With our sample, 87% say they either inhale it only or inhale it sometimes and puff it sometimes. It's really popular among adolescents to do sort of tricks with the smoke, which I guess is a little bit thicker than cigar smoke. So ghosting, you can make dragons and halos and tornadoes. And if you want to know exactly what those things are, you can ask Rose.
Or look on YouTube.
Or look on YouTube, absolutely. It's amazing what's out there. 77% of young adults said that they tried one of the flavors, but only about 23% currently prefer a flavor to original, and the most popular flavors are casino, wine, and jazz. So one of the most striking things, and one of the most prevalent things we found, is that there's a real preference for smoking with others. We ask people if they prefer to smoke alone or with others, and overwhelmingly it's with others. So I have a couple quotes here. There's a real emphasis on, some people even seem to, they articulate that, when they're smoking black and milds, it's part of how they bond with their friends, they're socializing. And as I mentioned, there's the sharing, and there's almost like an expectation of sharing, at least if somebody wants to do that, then it's the norm to sort of pass it around like that. If you're alone and you're smoking a little cigar, it's really fairly unusual to smoke the whole thing at once. What's the norm that people described to us was to light it and take several puffs and then put it out and then relight it later. And I would say that on average people say about 3 or 4 times they light it to get through a whole black and mild. So you may have noticed there's some similarities, so it's sort of parallels between smoking little cigars and marijuana blunts. So they're both normally or preferably smoked in a group context. They both require preparation. So for the marijuana blunt, obviously that has to be prepared, the freaking of the black and mild, and then they're most often shared and passed around. But in addition to there being parallels in the process, as it turns out, they're quite often smoked together. So more often than not, little cigars are smoked either before or after a marijuana blunt. And here's a quote that kind of talks about that. Little cigars are considered to sort of extend or heighten the high of marijuana. And some people even talk about it as being a substitute. So if you don't have any marijuana, then a black and mild is the closest thing to it. Another thing that I thought was interesting, and I sort of mentioned this before, is that the habits seem to develop together. So if you start smoking one, you might well start smoking the other because they do tend to be passed around together. And I thought it was really interesting that in terms of becoming a habit, this individual said that, you start smoking weed and then you smoke more. You want more tobacco, so the more weed you smoke, the more tobacco you smoke. So I thought that was really interesting implication. So what do people believe about the risks or the harm from smoking little cigars? Everybody has their own equation for how many cigarettes a little cigar equals. I think the average is probably somewhere around 7 to 8. One little cigar equals about 7 to 8 cigarettes. But what's interesting is that this is sort of spun in different ways. So some people will say, well, I only smoke one little cigar. I might smoke 2 a day, so that's not so bad. And other people will say, every time I'm smoking a little cigar, that's 8 to 10 cigarettes. So it's sort of whether or not they think it's harmful is kind of how they spin that equation there. However, when people compare it to cigarettes, it's sort of hands down, cigarettes are the worst. Cigarettes have all these toxins in them, which little cigars don't seem to have, in their belief system. And then taking the cancer sticks out, I guess, makes the little cigar more natural. So there really seems to be this sort of hierarchy, I guess, where marijuana is considered the most natural, the least addictive, and the least harmful. Little cigars are in there in the middle, and then cigarettes are the worst for you, and by far the most addictive. So addiction, we asked them in a number of different ways about their experience of addiction, their beliefs of addiction. It's really discussed in terms of a lack of self-control, basically, sort of mind over matter. I thought this was a really great quote. Can you, from what you've seen, can you become addicted to little cigars? It's yes and no. It's up to you. It's how strong mentally that you are. And this theme was really repeated over and over again with regard to little cigars especially, that is something that you can control, whereas with cigarettes, not so much. So this is really interesting. We asked people if they thought you could become addicted to little cigars, and we also asked them if they thought they personally were. So among young adults, 93%, 89% of adolescents say yes, you definitely can become addicted to little cigars. Then are you personally addicted? 57% of young adults and 33% of adolescents. So again, it's not that people don't believe that you can become addicted, but it seems to be sort of kept at a distance from their own personal experience. Particularly people who smoke both little cigars and cigarettes, but even people who don't smoke cigarettes have a very strong opinion that cigarettes are the thing that's addictive. Little cigars are less addictive. So this is a great quote here about, if I want something to smooth and to relax me, I'll get a Black and Mild. But if I'm just feeding my addiction, I'll get a cigarette. And here's another one. This person, there's no doubt I'm addicted to cigarettes, but with Black and Mild, I feel like I have more control or a choice. So we asked people about quitting, if they've ever tried to quit, if they think that they'll quit someday. Again, people know that there's a risk. They talk about cancer. They're aware that it's addictive, but it just doesn't seem like it's something that they need to do right now. Some have tried to quit and cut back, but then they mentioned, something stressful happened and they went back to their usual smoking. Interesting, most people feel that they will eventually quit, and that when they do, they won't have much trouble with it. So just to kind of review the main points so far, there's a real challenge with terminology. Little cigar is a term that we use, but then we also modify it by saying like a Black and Mild. But it's something to keep in mind when the survey goes live, and when we're trying to ask people about what they smoke. It's going to be a challenge to figure out how to phrase it. Do we show a picture? So that's an ongoing challenge. And also multiple product use. When we were doing the interviews, if we're talking to somebody who also smokes marijuana blunts, we really had to keep coming back to, well, we're talking about little cigars right now, because especially if they smoke blunts frequently, their answers, it was clearly that they were starting to talk about the blunts instead of the little cigars. So how to really keep people on track with the specific product that we're asking about. I think the cultural context of smoking little cigars just seems to be very striking and really important. There's a certain social setting that's preferred. There are sort of norms about how it's done, that they're shared, and a common sort of set of beliefs about whether they're harmful, whether you can be addicted, things like that. And then lastly, what is the relevance of all these things for actually measuring nicotine dependence? So what we're doing right now is, so we've already presented a poster on this, and we're working on a manuscript from the findings that I've talked to you about today. We're also starting to write items, so questions about that get at the little cigar experience that we're going to be adding, as I mentioned, to the PROMIS measure. So we're sort of vetting some of those right now. In fact, these are hot off the press from yesterday when we met and we're talking about some of the items that might work. So for example, if it's not so much the norm to smoke an entire little cigar at once, then asking a question like, I smoke a little cigar myself at one time, could be an indicator of dependence.
A bit more about
yes.
the targeting opportunities and strategies, but how this will actually work to potentially get folks to come and complete our survey. But we're looking for potentially right now about 250 participants, probably closer to 300, participants to complete this online survey.
Yeah, come on up, Rose.
Before we, yeah, go ahead.
I don't know. I mean, it's funny that you mentioned the social media piece, because today is probably a bad day to talk to me about this, because I just ran, while we will probably rely heavily on, the social media piece for, especially to try to reach teens or people on the younger end of the spectrum, it is a challenge to put up ads on, say, Facebook, because there's a lot of automated restriction, and in terms of, like, you can't, I just ran an ad today based on the guidelines that they gave me, and they still pulled it just because it has, like, the word cigar in it, or, it's a challenge. So if anybody has experience with that, that would be very welcomed. Actually, having a successful ad campaign on social media like Facebook. But I think that is the goal, is to hopefully, the key is with, social media like Facebook or Instagram, is that you can target a very wide audience. Your reach is so much further. When and also, ideally, in an ideal situation, it's a very sort of homegrown process too, where you can go into the Facebook ad editor, create your own content, target who you want, say 14 to 17-year-olds within a 25-mile radius of Cleveland, and it spits out an output of a potential reach, say 22,000 teens. You can, put up different parameters, and it'll tell you how many people you can actually reach, and then you put in that ad, and it tells you how many people you did reach. And based on just a very, very brief test, I was able to reach thousands of teens in the Cleveland area, and get at least maybe, like, when you think about it in the broader spectrum of how many people you're reaching, the number of people you're getting to your website doesn't seem that big, but at least like 100 or so clicks to your website, which is translates into how many interests, calls on my phone. But so anyway, that's kind of the strategy we'll be using. But if it's been a challenge, because there's a lot of restrictions on tobacco and any sort of alluding to its use or purchase or sale at all. So.
Yeah.
You mentioned that it was difficult to get the 14 to 18-year-olds to call.
Yes.
Have you considered putting a QRI code on your advertisements that they can kind of click with their phones and get in touch with you that way? Is that or?
Yes, we did talk about that at one point, didn't we?
Yeah, it has not been that effective.
No.
In other studies.
In other studies, okay.
People don't use those codes, actually, that much.
Oh.
I'll just mention also that we're building into the survey sort of viral peer-to-peer recruitment as well. So when people take the survey, they'll be given the option of sharing it on social media with their friends, and there will be an incentive system as well for that. So not only are we going to sort of advertise it within social media from a more mass marketing perspective, we're going to try to leverage sort of peer-to-peer viral recruitment, and we'll see how that works.
I was late, so I'm sorry if I missed this already about where you guys have marketed to, but have you thought about utilizing our 22 rec centers, the MyCom network, with all the providers that participate in that?
Yeah, we've reached out to both of those, and as far as rec centers go, they've been very hit or miss. I think I would say across all venues that we've tried to reach out to, especially with the exception of sort of the people who work with, say, at-risk teens, directly, like either through an after-school treatment or an after-school prevention program, but say like a rec center or the MyCom youth groups, they have not really been as responsive. We've been able to go into a few rec centers and they'll allow us to post our flyer, but then most others will say, no, you can't post that here.
Ellen, did you go through the commissioner
one of the people I did say, well, you have to go through the commissioner, and I asked, okay, how do I go about doing that? She said, I'll take it to them. And and then she, of course, promptly came back at me and said, no, the commissioner said no, and wouldn't give me a name or anything like that.
He's very easy to work with. He's very open. He's like, whatever you want to do, whatever's going to help our kids, make them better. His name's Sam Gisentainer. He's wonderful. If you want his information.
So can we connect with you after this?
Yeah.
Yeah.
Great.
I know you haven't had much success so far, but like maybe another try or,
Yeah, I would love
very
another contact.
open.
It's always, at least for me, it's always been about, my success has usually been through, actually, like people in the PRC have connected me directly with people. And I would say the adolescent group, that was key because I was engaging the adults that they trusted, and therefore, and so I would say with the calling thing, of course we have a handful of people who did call based on a flyer they saw, but people don't like being on the phone, making phone calls anymore.
Right.
And so being able to do in-person interviews or at least engage the adults that they work with has been kind of key. And the rec centers I really would like to try to explore that some more. So I would like to connect with you after this. But that's kind of a lot of people. I will say we get responses like, yes, our youth definitely smoke these things. Come talk to us. Or my kids don't smoke those things.
Right.
That's not appropriate for us. So that, I think, I get those kinds of responses, and it's been a challenge to say, we're not an intervention study, but we're interested in what you have to say about them, because that's where we want to start.
Yeah.
Do you look at church youth groups?
There's been a couple, I want to say, that I have reached out to, and it's kind of the same response. Our kids don't do that. There's other programs that are hosted in churches, but are not necessarily religiously affiliated, that I have worked with, and have been great. So, yeah.
Yes, Elaine.
Yes, no, this is back to the context question. So it sounds like definitely Little Cigar use is more social than it is. That whole concept of smoking a cigarette separately. How much of the time is spent in the actual freaking, for example? Is that the social component, or is it the smoking that's the social component? Do you know?
That's a good question, because some people do freak them in the social context. Some people freak them ahead of time so that they have them when they're. I don't have a good sense of overall numbers, but my impression is that they're freaked as needed, and that it is done in the social context. As far as how long it takes. We could pull up a YouTube video, and I think a part of it depends on your expertise too.
Well, I'm just kind of, maybe I'm showing my age, and maybe giving away more than I want to, but, in the 60s and the 70s, rolling a marijuana cigarette was something you did socially, so also to show your expertise in doing it.
Exactly.
And so I'm wondering if there's a similarity to...
I think there is.
I think there were, I shouldn't speak about the qualitative data being so distant from, but that sometimes an individual was identified as the person that you had do it. People were
The expert.
in your group,
Yes.
they would do it for you.
Exactly. And another, one of those parallels where this is something that you do in the group context, it demonstrates your skills and your ability, just like the smoke tricks and so on. It's all part of that process. Sharon, yeah.
How does it differ from adults, older adults smoking little cigars? Because I see individuals in the street.
Oh, sure. Yeah, this certainly isn't limited to these age groups, but not really being able to speak to the, other than sort of anecdotally that older folks tend not to bother to freak them. I'm not sure how well, what else to say about that group. Not as familiar.
Is there research on the frequency of smoking or?
This we
Although
leave
I
it
think
in the
Age
older.
groups, because this is the largest, this age group are most prevalent in smoking these products.
Largest users of it.
It probably drops down to 3% or so once you move beyond the young adult age range.
Oh, really?
It's really infrequent among older adults.
Well, at least the older adults that are older adults now. The question will be is when these young adults.
That's a good point, yeah.
it continues to be their prominent.
Yeah, and that's another interesting question, is what really is the trajectory of, introduction of these products, and then, using multiple products, and then what are, do you continue to use tobacco in 10 years, and if so, what do you use and how much? I don't think there's good information on that available.
You asking those folks if you can keep calling them?
I know, we should be, well, we're asking if they're, I think we're asking them if they're interested in participating in the future, so we have their contact information. Yeah, but it does seem, I'm really interested in, is there a trajectory of little cigar to cigarette? And then is one given up eventually or not, or do people continue using multiple products? It's a very interesting question. Yes?
I'm just wondering, do you discuss the financial implications of smoking? And I'm just thinking 140 a week.
I know. Well, that's the thing, is we're not, we're not intervening, and we don't want to give the impression that we're trying to convince them of anything. But people bring that up, and it's interesting because mostly the finances they're inexpensive, and that's why, especially when they're sold individually. But people do bring that up, that, they don't like spending so much money as it becomes more habitual and they're buying more. It's definitely something that's on people's minds, for sure. Somebody over here? Yeah.
With the online survey that you guys are going to be rolling out, are you only opening that up for the adolescent group, or is it still the same?
It's both adolescents.
Yeah, the whole group.
So basically 14 to 28.
Yeah. Yes. Yep. Anybody else?
Well, thank you very much.
Okay. Well, thank you very much. Thank you.
Thanks to all of you for enriching our conversation here. If you did sign in, please do that, and stay tuned.
And wow, that went really fast. So that's all I wanted to say about that. And again, I would love to get feedback from you all and your input and experience, if you have any, with especially how to reach these folks. We still have a few more adolescents to get, but would like to just open it up now to questions and comments. Thank you.
Is that new law where you have to be 21 to buy tobacco products going to affect?
Yes. Well, it's 18. Isn't it 18 now?
21. It's going up to 21.
It's going up.
I believe.
Oh, okay.
Tomorrow.
That's right. It was 18. It's going up to 21. We have spoken to a few people about that. I don't know. Maybe Rose can answer this a little better. I mean, the adolescents we've spoken to who have never been legally able to buy little cigars have never found a problem. So I'm not sure that that's going to change. I mean, people are aware of that, but
Yeah, I would say, again, we don't have anything definitive, but like anecdotally, I've asked that, and they, like, maybe one or two say, it might, probably might be a little bit harder, but overall, because depending on how mature they look, they can just walk in and usually not get carded, or if they are, they kind of just look at it for show, but still give them whatever they are purchasing, or they'll still go through the way they do it now, which is asking strangers on the street to, standing out, just like, standing outside of the corner store and asking the passerby to buy a smoke for them.
They'll get prosecuted too if somebody is caught selling, giving buying for a younger person.
Yeah, I think it just is a question of, now that the ban is going to be in place, whether or not the enforcement is going to get stricter, because the restriction has always been there, but it's never enforced, really.
Yeah. And then, kind of with that, I'm kind of wondering, marijuana, it's illegal, right? Do you think some of the young people might not want to sign up because Because since it's illegal, they can't admit to it?
Yeah, that's an issue. And actually, for our study, I can say that one reason why it was really difficult to just get people to participate was because they're like, I don't really smoke cigars. I just smoke marijuana. That's it. And I don't, for this study, we really wanted to look at little cigar use. So while they obviously don't want to admit to that, and that's always a challenge when you're recruiting something for something like this. But most people will, once you obviously let them know this is a confidential, anonymous study, you will not be, we will not contact any legal authorities about this. You develop a somewhat sense of trust with that person, and they're usually pretty open about. And even the adolescents that I've spoken with, they've opened up, a little bit about some of those kinds of things.
Yeah, I would say, with the young adults, there a lot of times there was no hesitation whatsoever. It was not. It was an open. They're smoking.
I'm just concerned, is the law going to be stricter? Like, could somebody be standing outside of a meeting room or something? If it's going to become stricter?
I have an answer.
Yeah.
So the law is only going to be applying to people who are selling to underage. So like if I'm a kid and I'm 19 and I'm standing on the corner and I'm smoking, no, we're not. That was very intentional. We didn't want to criminalize you or go that route. We wanted to make sure that it was more about the store owners or folks who are retailers selling the products. The intent is to kind of stop early initiation, since we know so many folks who are now adult smokers start as youth. I think it's like 90%. Also, there's another point I was going to hit on because you brought up something else. In terms of people following it or not, I will say I'm encouraged to find, even though the law takes effect today, a lot of the retailers had already been putting up the signage and everything in their stores prior to the implementation. We received a lot of calls about the law already, but none of them so far, I know I'm going to be wrong soon, but so far none of them have been complaints. More just like questions, like about like, can my, staff at the store sell it if they're 18, those kinds of questions. And this is an anecdotal story, but my colleague was in the store the other day and somebody came in, it was a Dollar General store, I think, or a dollar store, and the kid was like, I need to get cigarettes for my mom, and the clerk was like, I'm sorry, honey, I can't. And he's like, but she's not feeling well, and he's like, sorry, I can't help you out, the law, blah, blah. So I'm hoping, I know for your study you guys want to get people who are smoking, but I'm hoping that the law I know you don't want people to smoke, but I think there's some promising, we're already seeing some promising evidence that this law is going to have an impact. And then for those who don't know, I should also mention that there is a flavor ban proposed that's sitting in council now. It's already, flavor restriction. So unless your store sells 70% or more tobacco products, like 70% or more of your profits come from tobacco products, you would not be able to sell flavored tobacco if this law was passed. So right now, it's been passed through our Health and Human Services Committee. It's been sitting in our Finance Committee's review. And so as soon as they review it, which hopefully will be soon, and vote on it, then we'll know for sure if that will go into effect. And so that will just be another layer.
Thank you. Great, thank you. Yes?
I just have a quick comment. It's interesting is that if you think about when was the Board of Health's, so when there was a lot of tobacco prevention money in town, there, 03 to 07, there was a big ad campaign that said, and they were on the sides of buses that said, one little cigar is equal to 8 cigarettes.
Oh, okay, there you go.
Thank you.
That explains that equation.
That's right. Is that really the influential piece? That's kind of amazing.
Yeah, if that's what it was, then that certainly has gotten the word out.
Because I don't think we still don't have a very clear answer to what the equivalence is.
Well, can I tell you? Because at some point, somebody asked us to give us this, they asked for the source, I think we went looking for it, we couldn't find it. It wasn't our ads, but I mean, it was part of the
Yeah.
large consortium that did it, and I think when we asked them, they got it from, do you know where they got it from? But that's the thing, like, that's even funnier.
Yeah, right.
Maybe somebody made it up, but, yeah.
So maybe bus advertisements are really the answer for us in terms of recruiting. Getting the word out.
So, I'm curious about, I think there's a lot of really rich, interesting findings from the qualitative piece and perhaps more than one manuscript that could get out. But I really like the idea of the parallels between the little cigars and marijuana and highlighting that. But I'm wondering who the right audience is for that, and if this group has some suggestions, and then just thinking about some of the other findings that we have, and thinking about audience and message and how to get some of this out. If people have ideas or thoughts around that.
Yeah.
Well, when you mentioned that, years ago, and I'm talking people maybe like in their 40s, now they're like in their 60s, 70s, and I'm thinking maybe that age group and even nursing homes or something.
For?
As a group, because aren't they using, it seems like to relax people and things like that? It's just that, it's coming up, and I know there was questions that were talked about years ago, and these people now are older, so maybe reaching out to older people.
You mean to see the reasons for smoking little cigars, or to just
maybe to, since I know the medical marijuana issue came up, it seems to kind of help people to become more relaxed.
Yeah.
My name's Nick. I'm a family doctor at University Hospitals, and I'm seeing patients in an urgent care setting. And on one day we had like a 55% tobacco use rate, and it's just a little bit too old for who you're looking for. They're like 18 to 25 is about the average, but it seems like incidental to care for other stuff might be an environment to in a kind of an urgent care for pediatrics.
That's interesting.
Well, we're certainly interested in the 18 to 28. That's the young adults, 18 to 28, and interested in that group for. So the next phase. So the qualitative data collection is just about complete. We have a few more adolescents that we'd like to get, and particularly like to collect some data on girls. We're underrepresenting girls right now. But I think that what we learn will perhaps add a bit to these core findings. But for the next phase, where we're headed is to do a web-based survey that will have these measures where we're very interested in nicotine dependence, as well as indicators on different domains, different things that we'd like to be able to measure. And that will be broadly available, and people will be eligible, either adolescents or young adults. So essentially the 14-year-olds through 17-year-olds is the adolescents, and then the 18 to 28-year-olds for young adults. Right now, we're still debating a little bit around sampling and geographic sampling. Certainly it'll be open to folks in Cuyahoga County and perhaps broader, and we're considering collecting data and reaching out through our web-based advertising to a couple of other areas within the country to get folks to complete the survey. So that's what's coming. That's what's coming next. So having some ideas or some feedback about venues to share information to help, post flyers or raise awareness about it. The social media strategy is a little bit new to us. I don't know if you could flip back to that one, and then maybe Rose can tell us a little